Welcome. We're so grateful to have so many of you folks participating today. Before I get started, I want to thank the leadership from several of our YWCA associations who joined us for Capitol Hill meetings this week. YWCA Metro St. Louis from St. Louis, Missouri, and YWCA Tri-County from the state of Pennsylvania. Thank you for joining us. And the YWCA leaders who will join us for the virtual briefing we are now going to experience are from YWCA Lancaster, Pennsylvania, Central Alabama, YWCA Central Alabama from Birmingham, Alabama, and YWCA Austin from Austin, Texas. And I also want to thank the YWCA USA staff, especially the policy and advocacy team. Thank you for making YWomenVote and our conversation today a reality. The 5th National YWomenVote survey emphasizes that even in a time when our country seems so divided, women are united in giving name and voice to priorities, regardless of age, ethnicity, political affiliation, and geography, and are powerfully united and more than ever before. Today, we all have more in common than our social feed would have us believe. We want our families and our communities to be safe, healthy, and successful. The issues that women cite as their greatest concerns in this survey are foundation to that exact vision. Childcare, gender-based violence, housing, access to reproductive justice. These are economic issues, community issues, employer issues, education issues, family issues. These are issues that set the stage for all of our futures. Safety, education, and housing can be found at the YWCA because we are among the largest provider of these services in America. We have an authentic and deep connection to these issues because we experience them firsthand, along with those that we labor with in community and those who engage with our services. This survey intentionally emphasizes the voices of women of color and specifically young women. And the results tell a story that many of us have heard before, but from the voices that are often silenced. Gen Z is the largest generation in America today, and 1 in 5 Americans is a woman of color. And we are here to put them first, not last. More than 2.5 years into the COVID-19 pandemic, and women continue to carry the weight of the nation and will soon be leading the ways into the fold. Young women, in particular, are shouldering the burdens of economic uncertainty and threats to body autonomy. And the generation defining experiences of racial violence, mass shootings, a national mental health emergency, and COVID-19. Today, as YWCA associations continue to work in our communities to return to pre-pandemic levels, we see firsthand what families need to thrive. As members of Congress return to Washington, our organization has come together to elevate and remind our elected officials of what must be accomplished to ensure our families and communities thrive, to ensure that voices and communities are not lost in the voices of politics, and that our representatives remember that we all have more in common than we've ever been told. Critical investment in childcare, preventing gender-based violence, and other frontline services are critical to our communities, and they need to happen now. Funding, to them need to happen now. And based on our survey, one thing is certain: Congress can count on women and their allies to show up to the polls in November with these issues in mind. In closing, I ask you to remember today that the depth and the breadth of women and their lived experiences is profound. And so too is our vision and demand for change. And now, it's my pleasure to introduce you to Abby Fernando. Abby is an Associate Vice President on the Global Intelligence Team at Fin Partners, our partner in this survey. She has over 5 years experience in telling stories with data. She is an experienced individual in both quantitative and qualitative primary research, including survey design, focus group moderation, and in-depth interviews. She is experienced in analyzing landscapes and social conversations and secondary research to craft audience insights and competitive intelligence and strategy design. Abby has a degree, a BA in sociology, and an MA in sociology and research practice from American University here in Washington, D.C. And now I hand it off to Abby. Thank you.
Thank you very much, Margaret, and good afternoon, everyone. I'd like to start us off and speak to the methodology of the survey. So we fielded this survey. It was a national survey entirely online, and we were able to speak to over 3,000 women nationwide. Among this nationwide sample, we also spoke with oversamples of specifically Gen Z and Millennial women of color, as well as American Indian, Alaska Native women, as well as women in the states of Arizona, Georgia, Michigan, North Carolina, Pennsylvania, and Texas. And if we advance to the next slide, we can see the methodology of the survey as well as the field dates. The survey was fielded this previous July and August. If we can advance one more slide, we can move into the concerns section of our survey. And what we highlighted was a few different issue areas and measured women across the nation's concerns across these different issue areas, as well as their how they feel about policy solutions around these same issue areas. And we can advance the slide. One more. So looking at the top concerns across women nationwide, what we found is that women's top concerns are predominantly economic. The top concern, with 86% of women saying they're very or somewhat worried about this, is the cost of living. And what we find here is that not only is this among a specific demographic or a specific subset of women, we find that women across different demographics, across political ideologies, are most concerned with economic concerns such as the cost of living. The next top concern that we measured is mass shootings and gun violence, with 76% of women indicating either very, very worried or somewhat worried in this area. Again, this is another concern where we see a lack of variation by demographic or things like political ideology. We see across these different subgroups that this is a top concern for women overall. You'll see that other top economic concerns are also pertaining to the issue area of the economy, things like family income not being enough to afford, family income not being enough, or the ability to afford rent or mortgage also being top concerns. If we advance to the next slide, we can see how these concerns have increased over time as well. We tested these same concerns back in January of this past year, and across the board, 13 of these 12 concerns have increased. The only concern that we did not see increase was pertaining to COVID-19. Across the board, we see increases here. you'll see that the top concern with 14% increase is family income not being able to pay the bills, and then 13% increase for my ability to afford rent or mortgage. So again, these economic concerns we really see climbing across the board for women of all different demographics. You'll see also safety concerns, things like gender-based violence and safety from police violence, as well as the rise of white nationalism. Concern around these different efforts or different topics rather increased 10 percentage points or more. And moving on to the next slide. What we've done here was break out this data by these different racial and ethnic groups to be able to see the variation that exists among these diverse group of women. What we see among the top concerns is that there is some consistency. The cost of living is a top concern across these different racial and ethnic groups of women. As we move down this list, we see some variations emerge. And as a general trend, we see Black, Hispanic, and Asian women kind of showing more concern for these different issue areas compared to other groups. And we see this even starker contrast as we advance to the next slide, where we see some even stronger variation by race. Concerns around safety, specifically items tested such as safety from police violence, acts of hate, and racial violence are higher among Black, Hispanic, and Asian women compared to other groups. We also see higher level of concern from those groups among concerns such as receiving paid sick leave, receiving paid family medical leave, as well as concerns such as having quality, dependable access to childcare, facing discrimination in the workplace, as well as gender-based violence. If we advance to the next slide, one more, please. We'll see the top policies that we tested. So here we asked women about a series of policies across different issue areas and to what extent they feel it's important for Congress to take action on these. So we see that the top ranked policy here was preventing gun violence and mass shootings. There was 82% of women nationwide indicating that this was either one of the most important or a very important thing that Congress can take action on. Again, this correlates with the top concern that we saw as well of mass shootings and gun violence. And we see the same demographic breakouts here that women across all different demographic groups, women across political ideologies, all vote highly that this is one of the most important or a very important thing that Congress can act on today. You'll see that the second highest concern here is ending workplace harassment, discrimination, and sexual violence, where 79% of women rank that this is one of the most important or very important thing Congress can act on. Again, this is a top concern across different demographics, and we see that this is a concern for women in different states and different racial ethnic groups, as well as different political ideologies as well. Moving on to the next slide. Here we're focusing specifically on the policies within the topic areas of gender-based violence and childcare. Looking specifically at gender-based violence among women nationwide, we see that domestic violence prevention and services is something that women think Congress should, either one of the most important things they should take action on, are very important among 76% of women. And I'll read here the full survey language to get an idea of what they were responding to, which reads, pass legislation that provides emergency shelter services for domestic violence victims and their children, and strengthen investments in local prevention programs to end this cycle. Below that, we'll see federal funding for gender-based violence services. The full survey text reads, provide robust funding in the federal budget for programs and services that support survivors and prevent domestic violence, sexual assault, and other gender-based violence, with 72% of women nationwide indicating their support there. Following that, we see community services to address COVID-19 and stress, with the full survey language reading, strengthen community services to address the impact of stress and trauma on children and young adults, especially following the COVID-19 pandemic, with 66% of women nationwide showing their support for this policy. In the chart below, we'll see childcare, again, looking at the numbers from women nationwide and their support on different policies proposed around childcare and access to childcare. So high quality childcare Again, the full survey language reading: passed legislation to expand access to high quality childcare that is affordable, dependable, and accessible. We see 70% of women nationwide, again, falling into that top two box of one of the most important or very important thing for Congress to act on. Below that, we see living wages and training with the full survey language reading: support living wages and skills-based training for childcare professionals, with 72% of women nationwide showing their support. And lastly, we see childcare in the federal budget with the survey language reading: provide robust funding for childcare in the federal budget, with 65% of women nationwide showing their support for this. Moving on to the next slide, we'll look at the policy asking about increasing federal funding for domestic violence and community service. The survey language reads: increase federal funding for domestic violence, childcare, job training, housing, and other needed community services provided by nonprofits. What we see nationwide is that just about 3 in 4, so 75% of women overall, showed their support by indicating that this is one of the most important or a very important thing that Congress can act on. And we show here as well the breakout specifically among women in Pennsylvania and Texas. So isolating just responses from overall women in Texas, we see 76% showing their support, as well as Pennsylvania and Texas each 76%. What we've broken down as well is the different racial demographics of women within those states. And what we see is similar trends here, that in both Pennsylvania and Texas, as is true for the nationwide data, Black and Hispanic women show more support for these policies and are more likely to fall in that top two box compared to other groups of women. Moving on to the next slide, we're looking at the policy we tested around funding in the federal budget for programs and services that support survivors of domestic violence, sexual assault, and other gender-based violence. So our survey language reads: provide robust funding in the federal budget for programs and services that support survivors and prevent domestic violence, sexual assault, and other gender-based violence. Looking at women overall across the whole country, we see that 72% fall into that top two box, showing their support as either one of the most important things Congress can do or a very important thing Congress can do. Looking at the racial data nationwide, we see similar trends that we've seen throughout the rest of the survey. This is 80% among Black women, who show higher than average support compared to women overall for taking action on these initiatives. If we advance to the next slide, we'll also take a look at these numbers between the states of Pennsylvania and Texas. Specifically in Pennsylvania, we see that similar to nationwide, 73% of women overall show their support here. Breaking out the racial data just among women in Pennsylvania, we see similar trends. 82% of Black women in Pennsylvania show their support here, 90% of Hispanic and Latino women compared to 51% of AAPI women and 67% of American Indian, Alaska Native women. Looking at Texas, we see that overall women in Texas, 68% show their support overall for this initiative. Again, similar trends broken out by race here, where we see among women in Texas, 69% of Black women show their support compared to 75% of Hispanic women, 70% of AAPI women, and 79% of American Indian and Alaska Native women. And if we advance to our next slide, here we are showing measuring support for policies around providing funding for childcare in the federal budget. So the survey language reads: provide robust funding for childcare in the federal budget. We see ultimately nationwide 65% of women showing their support here, again falling in that top two box, which is an increase from what we've measured in January of just this year. So we see an increase of women nationwide showing their support for policies specifically around federal funding regarding childcare. We've also broken out the racial data here to see how this varies by these different groups of women. And we see stronger support specifically among Black women nationwide, 79% of women here showing their support for this category compared with 67% of Hispanic and Latino women, 70% of AAPI women, and 79% of American Indian, Alaska Native women showing their support for robust funding within for childcare within the federal budget. And if we advance one more slide, We'll see here that we asked similarly about childcare. The survey language here reads, pass legislation to expand access to high quality childcare that is affordable, dependable, and accessible. And even higher, we see 70% of women nationwide, again, falling into that top two box of showing support for this policy that was tested. Again, similar in Pennsylvania and Texas. Among all women in Pennsylvania, we see 71% showing their support here. Within the group of Pennsylvania women, we see that it's true for 78% of Black women, 84% of Hispanic Latino women, compared to 59% of AAPI women and 67% of American Indian Alaska Native women. Similarly, we see 70% of overall women in Texas showing support for this policy. Which is true for 74% of Black women, 76% of Hispanic and Latino women, compared to 47% of AAPI women and 54% of American Indian Alaska Native women. And we can advance to the next slide. Thank you.
Thank you, Abby, for your presentation and your ongoing relationship with Fin partners to make this critical information available to YWCA and all of our listeners today. Good afternoon, everyone. My name is Pam Ewan, and I have the privilege of serving as a Director of Government Relations at YWCA USA. I'd like to now transition our program to the panel discussion portion of our event. For the next 45 minutes, we will introduce you to three YWCA leaders who have not only been triumphantly carrying out the YWCA mission, but understand the concerns Abby just highlighted in her presentation through the eyes of women, children, families, survivors, and the communities they serve. They echo the calls to action highlighted in YWomenVote and are here today to tell members of Congress, the administration, and the community why immediate action is needed at this particular time. But before we begin, I'd like to remind our audience that if you'd like to submit a question for any of our panelists today, we are encouraging you to email questions in to our email address at YWomenVote@ywca.org. Again, that's Y, the letter Y, WomenVote @ywca.org. Now I'd like to introduce our panelists. First, we have Stacy Blake, Chief Executive Officer of YWCA Lancaster in Pennsylvania. A passion for justice guides Stacy's career in the social sector with previous leadership positions at the local, state, and national levels in Vermont, Florida, the District of Columbia, and now Pennsylvania. She has led national advocacy efforts on behalf of refugees and immigrants, survivors of trafficking or torture, and unaccompanied migrant children. Today, she leads YWCA Lancaster as an opportunity to create impact on the issues that matter to her most, eliminating racism and empowering women. Thank you for being with us today, Stacey. Next, we have Naya Diaz, Executive Director of YWCA Greater Austin in Texas. Naya comes to us today with deep roots and experience from the Texas borderlands, Rio Grande Valley, growing up as a migrant farm worker. As a bilingual professional, her background includes over 17 years of experience in nonprofit and HR management service delivery with the drive to advocate for individual and systematic progressive change through strategic thinking, capacity building, and community narrative. Naya is on a continuous journey of impacting women of color and passionate about breaking intergenerational cycles of harm and poverty. Thank you so much, Naya. And finally, rounding out our panel is Dr. LaGranda McGrath, Chief Executive Officer of YWCA Central Alabama, located in Birmingham and serving residents of Jefferson, St. Clair, Blount, and surrounding counties. Born and raised on the south side of Chicago, Dr. McGrath loves community and has a deep appreciation for its people and is evident through her work at YWCA Central Alabama. She joined the organization in 2019 after serving as Senior Vice President of Program Operations for YWCA Nashville and Middle Tennessee, and has been with the YWCA network for nearly 10 years. Together, Dr. McGrath has over 25 years of experience in the nonprofit industry, leading a continuum of services for thousands of individuals and families that address the root causes of poverty, support the educational attainment of children, youth, and adults, promote safety, housing, civility, and economic mobility, and champion social change. Today, she lives with her husband, Marvin, and are parents to 3 adult sons. Thank you, LaRonda, and thank you everyone for being with us today. I know we have a really exciting panel discussion set up. So for over 160 years, YWCA has been serving women and families in their communities at the forefront of the most critical social movements, from women's empowerment and civil rights, to affordable housing and pay equity, to violence prevention and healthcare. Each day, the hardworking YWCA leaders on the screen, their staff, volunteers, seek to fulfill our mission of eliminating racism, empowering women, and promote peace, justice, freedom, and dignity for all. As the largest network of domestic violence and sexual assault service providers and a large provider of early childhood education, our experiences and recommendations provided today are informed by the expertise and on-the-ground stories you are about to hear. So to start us off, I'd like to first go to Naya and ask you, can you tell us more about your programs at YWCA Greater Austin, Texas, and where you're seeing the concerns highlighted in YWomenVote data applied in your community?
Thank you, Pam. Yes, thank you for having me here, and I'm excited to be just being part of this group, sharing the data that we just got. It's actually very powerful, so thank you. So YWCA in Austin, we've been around for about 117 years. We service the Travis County areas and then about 6 counties in the surrounding Central Texas area. So that's Bastrop, Hayes, Williamson. We've worked in Blanco and Caldwell areas as well. We at YWCA in Austin stand at the intersection of mental health and social justice. We recognize the importance of offering services that address community needs and acknowledge the impact of disparities in mental and physical health and wellness. And we're committed to providing trauma-informed care. We offer culturally affirming services that we want it to resonate with everyone. We acknowledge the ripple effects trauma has intergenerationally, what it can do personally, historically, and collectively. Here at the YWCA in Greater Austin, we also emphasize the importance of connection and healing and thriving through life challenges and recognizing how factors of disconnection, such as violence, hate, and oppression, cause stress, anxiety, and depression, trauma, and many, many other mental health concerns. So our mission here is to really support the healing of the mind and the body, and both on the individual and collective level, so that we can live a life full of connection. So we know that it's not a secret that the pandemic affected us all today in many, many ways, and not just in our local associations. And what we are witnessing here in Austin in terms of the ongoing pandemic, but we also feel that the pandemic there's a pandemic of mental health, right? And I would go as far to say that mental health is one of the biggest crises today across our country, which is precisely what the data is showing us today. So by definition, a crisis affects large numbers of people. It must threaten the health over the long term, and it must require the adoption of large-scale solutions. And as I talk about our programs and the findings of our data, I'd like to insert ways in which there's a solution-oriented culture to this mental health pandemic, right? So with the current and ongoing cultural reckonings, we have also identified that racism is a mental health issue because racism causes trauma, right? Neurological research today will tell you that trauma is transmitted intergenerationally, and it affects the offspring of those initially affected through complex psychosocial pathways. Thus, racism is a mental health crisis that wasn't born today. and it is directly linked to policies and laws that affect us in our daily lives. And so we know that racism has shown itself especially during the pandemic, where we were witnessing Black and Brown essential workers with the highest death rates, right? And then also that through systemic racism, there has been a massive disinvestment in communities of color, disinvesting in Black and Brown communities, where there has been an elimination to access to wealth, access to good schools, and good health care. And as we recognize these challenges, we seek to find transformative and restorative methods of healing and trauma-informed support. We have recently been part of a collective where I know many of the YWCA sisterhood has declared racism as a public health and mental health crisis, which really does validate the threat that racism poses to society by linking it directly to social crises, like the increase of homeless communities, displacement of communities driven by bioenvironmental disparities, school to prison pipeline, compounded by the cultural reckoning and community threats posed by health crises. So yeah, I mean, on the day-to-day, we are always seeking ways to dismantle the systems that perpetrate these crises and rebuild our systems of care in ways that seek to undo historic injustices and inequities. So as we look at this data, we ask ourselves, so how do we use this data to achieve racial equity? And to achieve that is to achieve something that is a new reality where race can no longer predict life outcomes and where outcomes for all groups are improved. So we want to be part of important life-saving initiatives where governments are asked to help dismantle the system of racism. They must provide support consistently, evaluate where government actions reinforce racism, partner with racial and ethnic minorities to craft solutions together, and incorporate a healing process to address the trauma of experiencing racism. So that is what we're doing here. That is a lot here in Austin in terms of how we're looking at the work that we're doing.
That's definitely a lot. And I'm really grateful for that summary, Naya, and not only how you were able to bring in the interconnected and the intersectional work that you're all doing, but specifically how in YWCA Greater Austin, but across the YWCA network, we are continuing to look at these policies with a racial justice lens. So thank you for lifting up those points and look forward to getting back to you on a couple follow-up questions. Next, I'd like to bring it over to Stacey. Stacey, same question for you. At YWCA Lancaster, can you tell us a little bit more about your programs and where you're seeing the concerns that, specifically some of the concerns that were highlighted in YWomenVote?
Yes, thank you so much. You know, what stands out for me in the survey is women having deep concerns for their lives. I mean, we are concerned about our economic situations, the cost of living, our income not being high enough, not having equal pay. But women are also concerned literally about their safety from gun violence, gender-based violence, police violence, and the rise of white nationalism. At YWCA Lancaster, we see these concerns in real life, as YWCAs across the country do. You know, regarding the economic concerns, our emergency shelter and low-income housing programs have constant wait lists as folks struggle to find housing in our area that's affordable on their income. One response to that for us is not only trying to build additional housing units, but we have a new Choices Career Development Program that benefits individuals in transition by providing skills and resources in job seeking, training programs, and resume writing, you know, and graduates can then access scholarships to continue their education, skill building, formal education. This type of program has a high success rate because we're building for the long term. We aren't just looking for a job for tomorrow. We're looking for an opportunity that meshes your skills and interests and will provide a family supporting wage for the long term. Now, regarding women's concerns for safety, we have operated a sexual assault prevention and counseling center for over 30 years at our location. And just this year, we actually doubled the number of adult clients served and more than tripled the number of child clients served. Our hotline calls were 12% higher this year. You know, I'm particularly concerned with the high number of child victim survivors. For example, we have a number of teen survivors who, now that school is reopened in person, are returning to situations where they might have interaction with the person who harmed them. And they're trying to do this in high school, in person, and managing their trauma. You know, we've been here, as many YWs have, for more than 100 years. It's our second pandemic. Last year, our YWCA served over 8,000 individuals. And like other businesses, we have adapted to remote work, telehealth services, and other changes. And now we're back to in-person counseling in our counseling services, as well as, you know, offering all of our other programs, both in person and sometimes online. But our staff are stretched. We share individually the same economic and safety concerns as the data indicated for both our staff and the individuals that we serve.
Thank you, Stacey. I really want to be able to emphasize that in your remarks, you brought out that this is an ongoing pandemic that our audience really needs to remember. Services remain high, are going up in many cases, yet the workforce, and particularly the retention issue that we hope to dive into a little bit later, is imbalanced, and those scales need to be balanced, and not only balanced soon, but immediately, to ensure that you and your wonderful staff at YWCA Lancaster can continue turning on the lights and opening doors for our community. So thank you for those remarks. Finally, LaRonda, how can we help you, or what's going on at YWCA Central Alabama that we'd like to bring to the audience today?
Okay, I first want to talk to you about our programming at YW Central. We have been around for 119 years, and we have 3 core programs. We have a nationally accredited child development center where we serve children ages 6 weeks to 5 years old. We serve the entire family by engaging those parents, because we know that parents also need our support as their child's first teacher. Our second program is our domestic violence services, and it serves people survivors from 3 counties, but also surrounding counties. And you mentioned those, Jefferson, St. Clair, and Blount. We provide a 24-hour crisis line, shelter, a confidential shelter, counseling, therapy, strangulation forensic exams, and all of these are really critical for our community. And finally, our community housing program, where we own 135 units of affordable housing, a mix of transitional and permanent. We operate a family resource center where we serve youth and adults, as well as a shelter where we house intact families. And those are pretty rare, if not the only one in our area. And finally, we wrap support services around all of those programs, because people bring their whole selves to, they're not just a monolith, they're not just one thing is happening. And what we're finding is that if we don't provide the service, someone else that we know of great partnerships in the community in which we can link that family to. So what the data for me is, what it's telling us in the survey, it really highlighted what many of us already know to be true. And that is that women are really concerned about gender-based violence. It's up 13% between the last time we surveyed, from January to June. And this just squares exactly with what we're seeing on the ground. We have seen over the pandemic an increase to calls to our crisis line. And some of these were calls for just basic information, but basic information all the way to being lethal in nature. We are seeing our shelters full. And even that is rare. So regarding childcare, over half of those surveyed stated that they want affordable, they want dependable, and they want accessible childcare. And that is up 16% since the last time was surveyed. Both of these are chief concerns that disproportionately impact women of color. And we know that childcare helps families escape poverty. so that they can either work or they can go to an educational or training program. And so those are the things that we try to do at Central Alabama to make sure that we're addressing those needs so that our families can be set up for success.
Thank you, LaRonda. And I really want to appreciate how you emphasize that families and the survivors that you see are not a monolith. They're different from Central Alabama, they're different in Lancaster, and they're different in Austin and across the YWCA network. And the unique day-to-day challenges of the YWCAs that you see on the screen are different day to day, hour to hour. And that's why I think we're all getting on the call today to really say we need some help in order to ensure that we can continue the continuity and the fluidity of the services going forward. So I'd like to move on to the next question because LaRonda and Stacey, particularly in a lot of the programs that you had referenced, they are recipients, and same thing goes with the programs in Austin as well, but they are recipients of federal funding, federal grants in particular. In particular for LaRonda and Stacey, your respective programs, they are recipients of FIPSA, or the Family Violence Prevention and Services funding. Stacey, the pandemic really, as you had mentioned earlier, exacerbated existing barriers and complicated much of the work you and your staff are conducting on a daily basis. Again, the services are remaining high. They are on a rise with a 12% increase in calls to your domestic violence hotline, among others. What are the most effective actions you think that Congress and or the administration could take to essentially dismantle some of these barriers that maybe you, your staff, survivors are seeing at this time?
Yes, thanks for that question, Pam. You know, sometimes I think our biggest barrier is our mindset. You know, there is always talk about criminal justice. And of course, this is a foundational idea in our country. But I'd like to see a greater focus on victim justice. And this means supporting domestic and sexual violence survivors in the ways they most need. For some people, this could include an arrest and prosecution, but it also can mean concrete support to survive in the days and weeks following an assault. This requires direct financial payments for folks who cannot work, the medical, legal, and counseling support available in the ways survivors want, meeting language and cultural needs directly. You know, one thing every survivor I've ever met has said is, I never want this to happen to anyone else. And the only way to achieve that is to do prevention work. All of us are engaged in prevention work, and it never feels like enough. Our FIPSA money was used for modest staff salary increases to keep pace with cost and to recognize the incredible work that staff had accomplished the past several years. Other funding streams had had no increases. So this was really a lifeline for us. But I want to emphasize, 76% of women in the survey want increased funding and attention to policies specific to sexual violence, and 81% of Black women in Pennsylvania are saying this.
Thanks, Stacey. LaRonda, Stacey brought up a key word there, and I think it's a key word that's critical to YWCAs. I'm going a little bit out of order here, but want to flag for you that in addition to the life-saving domestic violence services that you recently stated, a primary prevention program called the Amend Together program has not only recently kicked off at YWCA Central Alabama, but is getting legs across the YWCA network. Can you tell us a little bit more about the program, why that is important? I want to be able to link that the work at YWCA Central Alabama, the prevention work that's happening in Lancaster, to Stacey's point, it's growing legs and getting across the country. Can you tell us a little bit more about the program and why it's important?
Absolutely. I am, first of all, so thrilled that FIPSA, this most recent funding has occurred, because prevention work is important. You know, intervention, we're all, you know, many of us are used to. I mean, intervention is all about life-saving. It's about changing lives. And what we need to do a little bit more of is to go upstream a little and provide more prevention programming so that we can see a decrease the goal is in intervention services, right? So the Amend Together program is a program that is of Nashville YWCA. And now I think about 8 or 9 of our sisters are providing the Amend Together program. And Amend Together is an opportunity for men and boys to get together and to be a part of the solution to ending violence against women and girls. These are men who are mentoring, in a sense, boys, but being able to have conversations with them about what does it mean to have healthy masculinity? What does it mean to unpack that man box, if you will? You know, being able to show emotions, and sometimes, you know, men being together in one space, they're able to have those conversations that they're not necessarily able to have in certain communities. And so we're providing it at Central Alabama in a community setting. The program can be provided in a school setting as well. And so we're really excited. And I think we're gaining a lot of momentum around this program. And pretty soon, I am sure that many of us will be seeking funding, additional funding, either from FIPSA to implement the program in our community.
Thank you, Lorenda. And I know that we are really excited to maintain that conversation about the Men Together program, the FIPSA money that's included to really ensure that was passed out of the House of Representatives in October 21, because it included a proposal to support grants to expand community-based prevention. So I really think that if we are able to raise our collective voices as YWCAs to talk about the importance and the need, not only for this program, but for it to be funded going forward, we can really continue to make life-saving progressive actions towards getting ahead of this critical work and critical conversation. So thank you for sharing that with us. I want to take a little bit of a turn and a little bit of a shift here and bring in Naya to the conversation. Naya, according to the YWomenVote survey, 47% of women overall are still concerned about the stress, anxiety, and trauma of COVID-19. But notably, 51% of women overall said that they were somewhat worried about access to affordable mental health services. Again, at the top of your remarks, you really referenced how Austin and Greater Austin is tackling that issue. But, if you had, or if you were able to sit in front of your members of Congress or staff today and really explain what you need in order to ensure the continuity, and you can ensure a robust support for that particular program, what would you tell them right now?
Well, good question. Thank you for asking. No, I think the data is, again, it's really impactful. It's really helping me also just connect the dots with the work that we're doing. Sometimes you get so ingrained in the work that you're doing on the day-to-day, just, making sure that we're servicing our clients and that our staff are supported so that they can do the work. And many of the people that we have working at the YWCA in Austin are therapists, they're social workers, they're youth program specialists. So again, you get kind of, in that space. And right now I feel like I'm just kind of looking up and I'm seeing this other view, and it's really helping me connect these dots. So thank you. I think what's important here, because I think the question here, that the part of the question that's really narrowing in my mind is that intersection between domestic violence and mental health, and that a lot of the data that we're seeing is really connected to that. And there's a lot of legitimate concern there. And we see it every day. We see a lot of women come through our doors or through our Zoom windows and tell us, that they're concerned for their life, or they're concerned for their children. Mothers are concerned about how they are going to send their children to school. Because in Texas, just a few months ago, we had a mass shooting that really, shook us to the bone, right? And all of our Texas communities. And so these are real feelings that we really want to be able to talk about and think through and work with our clients so that we can help navigate these feelings in order for us to really meet the demands of this moment in time. So one of the things I really wanted to go in on is the survivor services that we offer in our counseling referral center, which is actually in the midst of being called a trauma resolution center. The reason why we're calling it the Trauma Resolution Center is because we really want to focus on the psychosomatic that meets the mental health needs, especially when you're working with the cultural relational model, which is really bringing in, you're meeting people where they're at culturally, either linguistically or their shared experience through culture, and really kind of meeting people there. So in those survivor services, we offer multilingual, multicultural, linguistically appropriate trauma-informed therapy with a wraparound offering around case management and trainings. And then we also, in that subset, recognize that there's this victimization that presents itself around where we're really trying to figure out how to talk about restoration and reintegration for a lot of the people that we serve. We know that in that there's also financial difficulties. There's changes in social status. There's a lot of complex home life issues, instability because of violence. And then also there's this victim re-triggering through the legal process that a lot of people actually leave out. We keep talking about victimhood in terms of what happens at home, but when people go have to, see their abuser in the legal proceedings, we also want to be able to help that person go through that process, because there's a journey there that we want to make sure we're supporting. So when I was looking at the data, it really just brought that to mind, right? That we're working with people's trauma, the journey that they have to experience, sometimes in a re-traumatizing way. So I mentioned a little bit about some of the strategies through trauma-informed care and cultural relational modeling, through the wraparound services of case management and trainings. But these strategies really do address the emotional needs of crime victims, and they assist in victim stabilization. They enhance the survivor's sense of safety and security, and they assist victims to understand and participate in the criminal justice system. In many cases, YWCA finds themselves we're performing our work in person or in the Zoom box, but we're also in schools where we might find ourselves in detention centers, in jails, in treatment centers doing this work. We're out in the community doing it there. We're meeting people where they're at. Victims of crime experience multitudes of challenges, such as emotional and physical trauma. There's a lot of shame associated with this. There's a lot of victim blaming that goes on. And there's like a misinterpretation of behavioral resulting from trauma and stigma related to being involved. So when we talk about trauma-informed care, we ask not what did you do, but what happened to you to get you to this point. So that's actually something we reinforce a lot. So we also understand that in an ideal world, prosecution would be the cornerstone that represents the closure of traumatic events through restoration and validation when they're going through this journey. But however, we realize and that in the reality, the legal process can be re-traumatizing. We really want to work with a trauma-informed, cultural relational therapeutic experience in conjunction with case management. And we feel that that is really there's a special need there, especially in this moment in time, as we're seeing an increase in crime, and especially in domestic violence with a lot of the women that we're serving. So the other thing I wanted to mention, especially in Central Texas, and I've been here in DC, and I've been sharing this a lot with a lot of our some of the dignitaries that we've been meeting here, and we are noticing in Central Texas that a lot of the people we serve in Austin are actually migrating out of Austin, and they're moving into the edges of the city. Most of it would be like unincorporated areas, or more of the Travis County areas that are included in the city, also in like neighboring counties. And really what this tells us when we're working with victims of crime is that we know, our therapists that I work with on the day-to-day know that when you're working in rural communities, it's harder for you to get the help that you need. Some of the data that I was working with recently is that in a city, you might have one therapist to maybe like 25 to 50 people, but in a rural community, it's like one therapist per 1,000 people, which is, it's a huge difference. And also not just therapy, but also just other services like transportation, to get to schools, transportation to just get out and do regular life stuff. So we're seeing that we are needed more in these areas, and we don't see a lot of the funding come through to those areas. They usually are historically left out, and we want to make sure that we're including them in this conversation. Especially, you know, in Central Texas, we're talking about Bastrop, Hayes, Williamson counties, and that we want to make sure that we're navigating some of those funding conversations over to those areas as well, because sometimes, again, I feel like they do get left out a lot. And so, especially, you know, as we're diving into the data around like what is accessible to the people that live in these areas, it's very minimal. So anyway, I'm sorry, I can get into this a long time. I don't want to drag this out, but
no, your passion, I think, Naya, and the work that you are all carrying out on the ground really speaks through your presentation. So I really do want to commend you for thinking through various angles of that. But I think what you had also mentioned is, and for my panelists, I'm going to go a little bit off script here, so just a heads up, but the accessibility element of services that YWCAs provide, whether that's rural, urban, or community, is critical to ensure that the funding is targeted to ensure that they are getting down to our various communities. But you had also mentioned, Naya, in your remarks, the re-traumatization, and that's the re-traumatization not only for the survivors as it goes through legal services, but also it's for our staff, for the individuals who are carrying it out on the day-to-day. I really do have to say, it's LaRonda, it's Stacy, it's you that also see this trauma. And not only are you seeing it in a professional life, but you're sometimes seeing it in many of the staff at the YWCAs are also seeing it in their personal lives as well. So I really welcome anyone to come into this conversation. LaRonda, Stacy, what's that mental health aspect for, you know, Naya had mentioned it about survivors, but for our staff, what's that mental health element? What are they experiencing right now? Are they also feeling it too? And how else can we help them get the support that they really need at this critical time? Open it up to anyone who's interested in chiming in there.
Well, I will just jump in. I think yes, they are feeling it. We're all feeling it. I think there's a tremendous amount of stress, as you stated, from the stories that they're hearing, from just not being able to, I think, do the things that in a normal, pre-pandemic way, that's a lot of stress. And you don't necessarily know that you're under stress, right? And I think it just, as you said, it just manifests in other ways. And so I think we have to be very intentional about making sure that if you have a employee assistance program, that you are making sure that you're making maybe referrals for that staff member, that you are bringing in professionals to talk to your staff, but being flexible, making sure people have what they need to be successful. We need to do all that we can to take care of our staff and to take care of, to do a better job of doing that and to take care of ourselves as leaders.
Pam, I think one thing that's true about YWCA leaders, my colleagues on the call and across the country, we are leaders who get it done no matter what. And the trouble is we've been doing that for 2 years with, incredible challenges and barriers, as we all have. And I think we're all realizing continuing to press that capacity to its extreme limit with not enough staffing, with not enough support is really, I feel like we're close. We're really close to the limit. When we can't open childcare rooms because we don't have enough staff to provide safety and ratio, when we can't answer a cry for help and counseling in time, in a timely manner that we expect, when we have to turn someone away from affordable housing, that hurts staff. It hurts all of us as leaders. We really are at capacity, and we are seeking more support, both on the mental health side, but literally on the staffing side as well.
Pam, can I add one more thing?
Definitely.
Really quickly. And this is for Congress. I might be stepping ahead of what you plan to do here, but we do need Congress to provide funding to support higher rates, higher wages for childcare workers and benefits. I mean, I think for a long time, this industry has received far less in wages and benefits than the K-12 system. And we need to ask ourselves, why is that? We need to change that. This is an antiquated system. We need funding to help. We need to figure it out, to reimagine the child care. What does a 21st century child care system look like? It doesn't look like it did in the 19th century, right? We have to make sure that we're bringing together people who can figure this out. Across the country, the median income is about $13 an hour. Our staff can qualify for subsidies, and that is not right. And so we have got to figure that out, and as well as making sure that we have funding to help families through this time period, and they have a lot of needs.
Loretta, that was a perfect transition to where exactly I was going to go to in our next question too. But before we do that, I do want to remind our audience right now that we are accepting questions via email. So if you have any follow-up questions for either LaRhonda, for Stacy, for Naya, please remember that you can go to YWomenVote at YWCA.org, and you can email those questions in again. Again, it's at the bottom of your screen right now at YWomenVote at YWCA.org. So, Lauren, I just want to follow up on that point that you really had brought up right now. We are not seeing family living wages for our child care and early childhood education employees at this time. They are leaving for better opportunities at, other locations and other places of employment. They are facing mental health stressors both inside the classroom as well as at home. And this is not just a pandemic issue. This is an ongoing issue that has affected the early childhood education workforce for a very, very long time, pre-pandemic, during the pandemic, and now as we continue to claw our way out of the situation. Can you give us a little bit of light about what that hiring and retention barrier is, particularly in the Alabama area, the Birmingham, Alabama area?
We do have people who are leaving the profession. These are people who are passionate about working with children, but they just cannot make ends meet. Now they're leaving to go to big box retail stores or to fast food chains, which there's nothing wrong with those industries. But when you're someone who has this passion, you want to work with children, but if you can't afford it, you have to take care of yourself and your families. So it's a national crisis. I don't see this as a wish list. I see this as being critical to funding. We could not go to work. Many of us, I know I couldn't have gone to work without having childcare. And so if we really want to see families succeed and to be successful, we have to set up the systems that are going to support them. And that childcare is a big part of that. So yes, when you have a staff vacancy, you may have to close a classroom because you're not in ratio. And closing a classroom, if you were that parent who's dropping off your child, and then you know that, oh, wow, my classroom is closed. Not all of the parents that we serve are able to just take the day off. They may not have the personal time to take it off, and they just can't, or they'll lose their jobs. So this is a critical point for our country. And I think we really have to pull together and figure out what we're going to do and being very creative around it. We can do it. I believe it.
I definitely think we can do it. And I think it's not that we can do it, it's we must do it. Because our economy, our families, our women, our children really depend on this system of early childhood education in order to ensure that we can continue returning to work. And one element I really wanted to be able to emphasize that you had mentioned is, there's nothing against going to the big box realtors. We definitely need them in our community too. But it's important to realize that our childcare professionals are skilled-based educators who are trained professionals to be and have passion and must be recognized for not only these unique skills, but these critical skills that are important to our communities. So I want to turn it over, maybe Stacy, if you want to join into the conversation. The childcare element is important to the community in Pennsylvania. Why is it important? Any particular concerns I want to bring in the conversation about? It's particularly important for women of color in our communities too. Any insights or comments or thoughts about that?
Yes, absolutely. I really want to echo what Dr. McGrath mentioned, because this challenge of staffing does mean that rooms have to close from time to time. Our ratio requirement is 2 certified teachers in every room at all times. And, you know, the folks who walk into our Lime Street building in downtown Lancaster to drop off their kids, you know, I see lots of folks coming in scrubs and construction boots. And as LaRhonda said, if they do not have the opportunity to take a PTO day because we aren't able to provide care that day, and it may cost them a day's pay. Not to mention, missing work unexpectedly for any of us is really not what your employer wants to hear on the regular. So not only do we need to keep our current capacity open, but you may recall we lost capacity as a sector in the last 2 years. There's not even enough spaces today for everyone who needs childcare to get back to work. And I think that's why we keep seeing that, you know, folks are not back to work. Well, folks need dependable, quality, affordable childcare to get back to work. And that includes before and after school care for, you know, as we say, the big kids, in addition to the 6-week to 5-year-old care that we provide in our excellent centers. You know, this is a question that impacts so many workers across our entire community.
And as we know, right now, women, and particularly women of color, are the slowest ones who are returning to the workforce at this time. But childcare will really essentially be that linchpin to ensure that we can get not only women, but women of color back into their communities, contributing for their families, especially when many of women of color are primary breadwinners for their families. So there's an economic component in addition to a family life-saving component. So again, I really, really want to thank you for diving into that. Naya, we really discussed some of the hiring and retention barriers, some of the need to be able to ensure that we are providing family sustainable wages for our child care providers. Given a lot of the racial justice work and the leadership in that space that YWCA Greater Austin is doing in their community, do you have any recommendations on how we may be able to ensure that we are inclusive in some of those efforts?
Yeah, great question. Thank you, Pam. I mean, I think some of the ways that we can do that, I think, and you know, and I heard that here as we were working with or speaking to some of the dignitaries here in DC, is that we want to continue these conversations and we want to have a trust-based conversation with our funders around the realities about the market rate right now. The market rate is not meeting the demands of this moment in time and beyond. There's a lot of reasons. You know, we can go on and on about inflation rates and all that other stuff. But what I also wanted to say simultaneously alongside that is that there is also this conception or this misconception that, you know, childcare services, because a lot of people are choosing to work from home or have their children at home, what people forget is that the people that are forgotten in that conversation are the people that can't afford to stay at home and work out of a Zoom box, right? And I think, you know, when people our Congress are having these conversations and that argument comes into place, I ask that you consider and think about the people that are forgotten, which are our frontline workers. It is Black and Brown communities, a woman, especially women of color, getting back into the workforce. So the inclusive piece to this is that we don't forget, right? And that we want to treat, and that goes alongside the people that are doing the job, our childcare workers that are going back, and that we're asking them to do a highly skilled job, and we don't want to be paying them the rates that we're paying, and just to echo what Dr. McGrath said, in our fast food industries, we don't want to be competing with that. Not that there's anything wrong with it but again, I want to echo that these are highly skilled, licensed, and many times positions that really do require, like we're asking that there's a dignified way to look at this, and when you're making these decisions. So, but yeah, I think, again, just to reiterate and just to recap, I think there has to be a way that we can keep sharing these stories and having a trust-based conversation with the funders and expressing the realities, and understanding the day-to-day. We are at ground zero, opening up our doors, experiencing this, and knowing, understanding what's happening. So I would encourage that we keep having these what I call reality checks, right? These reality checks across all sectors here that are involved in this. So.
Exactly. I think, and also what's fascinating is not only from the YWomenVote survey, we saw a disproportionate number of women of color that are calling and asking for that high quality, affordable, accessible childcare. But uniquely within the YWomenVote survey, we were able to see that a large number of Gen Z women of color, millennial women of color, and again, also mothers with school-aged children are really, this is a younger demographic that are also calling for, again, this access to high quality, affordable childcare. Again, just to call out some of the stats from it, 58% of millennial women of color, 59% of Gen Z women of color, respectively, were very or somewhat worried about access to childcare. So that next generation is already very cognizant of the problems that we are seeing on the ground. So it's time to act is what I take away from that call to action. So I really appreciate everyone going in and taking a little bit of a deeper dive into that childcare conversation too. So really to round us out, November 8th, it's election day. It's right around the corner. According to my rough calculations, we're about 55 days away from election day. And according to YWomenVote, about half of women surveyed are very enthusiastic about voting this November. So this is open to the entire panel here. What's one of the most important things members of Congress listening to this call should do right now for women, children, families, and the survivors that they serve?
I want everyone to listen to what women just told you in this survey. It is very clear. Women are united. Across our differences, we're united on the things that are impacting all of us together. The economic questions, the safety questions, the health questions, and the expectation that this is a role for government to support families in this way. I mean, I think it's been made very plain, very plain. And I want to encourage my sisters and all of us on the call to do what we can to help register each other to vote. Every state has different requirements. We have different timelines, deadlines, expectations, and we want to make sure we have accurate information and we get everyone registered to participate. That's part of our job.
Goodness, that's Stacey said it. Listen. That's step number one. People are telling you what they need, so listen. But yes, making sure that women know if they're registered, where to go to vote. Those sort of things are things that we can do on the ground to make sure that is they know their rights.
Naya, any parting words for us?
No, I think I want to echo what Dr. McGrath and Stacey said, and just really that when you're looking at the data, that what it's really telling you is that not only are you listening, but we're asking that we don't, we're not seeking to regress. We want to move forward. We're not looking to go back in time. We are like looking at a bright future, and we really want to thrive for that and aim for that. So that's also what I'm looking at.
Okay, can I just a general follow-up question for anyone who wants to field this one. Are there specific ways we can make absentee mailing, absentee or mail-in voting, in-person early voting, in-person voting on election day, more accessible for women of color? They are turning out, women of color are one of the largest demographics that are turning out to the polls, as we have seen from trends in the previous year. So we anticipate they will definitely be a critical voice heading towards the ballot box this November 8th. Again, these tactics, which again are different across state lines, but are very critical to ensuring that women of color in particular can make their voices heard. Any ways that we can continue to ensure that they're accessible for this unique but growing population, and in many cases, the populations that YWCAs represent too.
Pam, I just think it's so important that we use every opportunity. It could be through HBCU, sorority and fraternity systems, faith-based communities. The most important thing is to communicate how these changes, some changes in different counties will be happening between now and November 8th. And to have that accurate information of all the deadlines specific to your county, your precinct, your polling area. I mean, that's what's most important. I fear so much anyone, with one mistake who would lose that opportunity to vote. That's just heartbreaking to imagine. So sharing information using every tool that we have.
Now, is there anything unique in your community that you're doing to ensure that we're getting out the voice of women, and particularly women of color in Austin this year?
Well, I think more details to come, but Austin is helping lead a Texas-wide initiative with getting the vote out through a video project. And we're really just trying to demonstrate a lot of the issues in Texas that have been affecting women in Texas, and across many, many different things that affect women. And especially, as you highlighted in the data, when you were taking a deeper dive into Texas, we are really trying to narrow in on that and using that as a point of reference for that. But I also think in Texas, as we're doing this project, there is a strong sense that we want people to know that when you're voting, you're voting with women in mind, because women right now need to be the priority. And we're not really asking, right? We are saying we need to be the priority. It must be the priority. So that is a really big angle that we're taking out in Texas.
I like that. We need to be the priority. We must be the priority today. Dr. McGrath, can you take us home?
Well, we must be the priority. And we in Alabama, we do have get out the vote activities. We'll have folks come by, and we'll make sure they know where to register, if they're registered, and how to register, and if they're registered, and where to go vote. So those things are really important. But there's a law in Alabama, and we want to make sure that people understand if they have a conviction for a crime, what crime can you can still, what are your rights there under that particular crime? So really identifying to make sure that you have rights, your right to vote. So that's some of the work that we're doing.
I really appreciate it, because the voter education elements to ensure that people know and are informed when they go to the polls are important. So really what I'm taking away from a lot of the conversation in this section here is, for our guests in the audience, you can partner, look up your local YWCAs, find them in your local communities, because they are doing such great GOTV work across the country as a nonpartisan 501c3 organization. And we are really proud of the work that they are doing to inform and get our constituents and our voters out to the polls this November 8th. So with that, I'd like to thank Naya, LaRonda, Stacy for their time today and sharing their experiences from their local YWCAs and the impacts on their communities and the importance of Why Women Vote survey data. Also, I want to give another thank you to Abby Fernando from Finn Partners and our fearless leader, Margaret Mitchell, who opened the program today, and my colleagues in the Policy and Advocacy Department and all of our staff at YWCA USA. Without all of that backbone and support, we would not have been able to pull off not only this program today, but the massive but very informative report that we are proud and really excited to be sharing with you today. So with that, YWCA hosts this virtual briefing to explore the important role of women of color voters. Women are watching and will be taking these concerns and legislative priorities to the polls this November. As a reminder, we encourage you to learn more about the Why Women Vote survey by going to our website and downloading the full report, as well as the spotlights on women of color and the generational breakdowns by going to www.ywomenvote.org. Again, that's www.ywomenvote.org. We thank you for joining us and look forward to continue working together to eliminate racism and empower women. Thank you for your time.